All right, so balance is important. If you think about our cars, if they're out of whack a little bit, they pull maybe to one side, maybe to the other.
That's right, and with our bodies, being out of balance can bring a host of problems, headaches, blackouts, and for one of our next guests, low neck and hip pain.
Like that hip pain. Welcome in Ann Trumbull, joined by Dr. Drew Drummond from Spinal Balance Health Center.
Good morning.
Good morning.
Nice to see you.
Ann, what brought you to Dr. Drummond?
You know, I had spent about 6 months with hip pain. It got to the point that it was affecting my sleep. I couldn't sleep through the night and actually couldn't walk. And I had gone to a series of doctors, and the most recent one just gave me muscle relaxants, which affected my daytime life so much that I kind of ran out of options and couldn't kind of figure out where to go. And I had a cousin who had been to Dr. Drummond and talked about how effective his care was, and so I thought I would try it out.
Had you seen him on the Morning Blend?
No, no, not at all.
So this was new to you. What were you hearing from your cousin that sold you and said, yeah, I'll give him a try?
She has a little baby with a lot of problems, and she took Grace to Dr. Drummond, and it completely affected her baby's digestive system and all kinds of other things, and so that was really convincing to me.
Right, and so this hip pain, this neck pain, how difficult was it to work with throughout the course of a normal day?
Oh, it got horrible. I was changing my shoes and trying different exercises, and I think when it probably at its worst, it was taking 3 or 4 hours out of my day and probably 3 or 4 hours out of my sleep.
Oh gosh.
Oh, it was ridiculous.
You had things to do. You didn't have time to throw away,
absolutely.
right? And you're young and you're thinking, this isn't supposed to be happening to me now.
Yeah, absolutely.
Yeah. All right, so you go to Dr. Drummond. At what point did you start to see a difference for how long into his care?
It was only 1 or 2 adjustments. And I remember writing him an email because I was like, my whole body feels different. Even kind of how my neck is at the base of, or at the beginning of my back started to feel different. And
the doctor gave you his email?
No, he did not actually. He went online and found it.
How are your hips? You said your neck feels better. How are your hips doing now?
Oh, they're fantastic.
Yeah, back in your normal shoes?
Absolutely. Or I can wear heels again.
Congratulations.
Doctor, what was the first thing you did when she came in? I mean, what did you diagnose right away?
Well, what we try and diagnose with everybody is an upper cervical misalignment. Misalignments at the top of the neck will cause all kinds of chronic pain issues, but the number one is probably joint pain. It's the number one reported by people in the United States. And when the body's out of alignment, it causes stress to the joints. So we're trying to relieve the stress out of those joints. And we found that the nervous system is what is responsible for most people's posture going off balance, then leading into stress. So it's not, and we can see here how important the nervous system is to the body. Nerve impulses will go from the brain down through the brain stem and out to the entire body and then back up to the brain. And it's the same system that is controlling your posture. So when the posture goes off, it can cause hip pain, back pain, knee pain, and most of the time doctors will focus on the area that hurts rather than the entire body as a whole.
Why is it that something that worked for her also works for baby Grace? That this same kind of gentle treatment can be effective for different problems, different ages?
Yeah, that's a good question. At the top of the neck, the atlas bone that I'm adjusting is wrapped around the brainstem. And the brainstem conducts nerves that are going from the brain out to the body. So any function of the body is controlled by your nervous system and is subject to not working correctly. And in her case, it was nerves controlling posture. In baby Grace's case, it was nerves that were extending out to the digestive system.
You use this technique called NUCCA. How unique is this around the world? I know Mary said something. You're one of the few doctors in the world.
It's focused more in the United States and Canada. There's one in Hawaii, maybe a couple in Europe, one in Australia, but there's about 200 or 300 worldwide, mostly United States and Canada.
Is it a form of chiropractic?
Yep. I practice under a chiropractic license. This is just a very, very specific way of adjusting the top bone of the neck that really needs to be addressed.
This is what that adjustment looks like. And so you see his right hand making contact, but then his left hand almost acts as a form of resistance. Were you surprised at how gentle this was?
Oh, I didn't think he had done anything the first time I went in.
There was no popping. No big jarring of the neck.
Ann's probably never seen me adjust anybody before because she's always laying down, but that's what
that's what it looks like.
Okay.
That's right, but you knew. Did you know when you first stood up that something was different?
Oh, absolutely.
Yeah.
Absolutely.
Her shoulders were about an inch off from one side to the other. She had a half-inch short leg, and that's because the nerves were instructing some of her muscles to tighten more than they should have.
Does that take that somebody, in her case, that the body is that out of whack? Does it take a trauma event? Can it just be a gradual thing?
It can be any number of traumas. It can be a car accident, which is the most common as people get older. But for example, with her, cousin's daughter Grace, it was probably birth trauma or something like that. It can go all the way back to birth.
Was there anything that you look back on and said, boy, was there a fall or anything like that?
Yeah, I think I actually had a snowboarding accident that I remember. But it was probably 10, 15 years ago.
See, and that it has taken that long.
How do you know if this chronic pain is you're able to do something with this? How should people know if they should come in and see you?
Most people's chronic pain is because of a posture imbalance. We aren't just born normally with a bad hip or a bad low back. It comes that way over time. So chances are if you have a joint pain, it's going to be upper cervically related somehow. But in order to really tell if I'm going to be able to help somebody, I need to look at their posture. And that really gives me a lot of information about how much the upper cervical area may be playing.
How long does it take to look at that posture?
About 5 seconds.
5 seconds. And next time on the show, Doctor, I'm going to see you.
That might be fun. I should bring in a little posture
deal
right here.
Yeah. Are you willing to do another special offer for our viewers today?
Absolutely.
He does a specialty X-ray that is also helpful, not just that looking at the posture, but this X-ray that he does gives some more detailed information. And so he's done this before. Thanks for doing it again. The first 30 people who call his office, you get a consultation, an exam, and X-rays. That's an and statement, not an or. Want to be clear about that. That entire bundle for $50. So the next question is, great Mary, how do I get in touch with his office? Glad you asked. Call 452-3400. Spinal Balance Health Center is located in Millard, if you're wondering, and then online at spinalbalancehc.com. And in fact, on his website, you can even link back to all of his previous visits here to the show. So if you're not like Ann, where you've had neck pain or hip pain and there's something else there, you'd be amazed at the number of resolutions he's reached through this one type of care. Doctor, great to see you again.
Hey, thanks for coming
on the show. Isn't it amazing how Mary can actually hear our viewers talking to her? Right?
We're like this. It's the same wavelength, me and you.
Thanks for
coming. Good to see you.
And Doctor, good to see you.
All right, if you miss one of our